This morning, we have three quick briefs for you. Let me start from the bottom up. The third will be our COVID-19 update and some of the latest results from surveys that are being conducted by the Ghana Health Service and the guidance notes that they would like to share with us. Right before then, the second brief will be on some changes to our air travel protocols that have been put in place, a reference to the cost of tests, but even more importantly, who will now go into mandatory quarantine, who will not, and the sanctions for airlines that flout these revised guidance notes. But first, you do know that we have commenced the National Chocolate Week. It started yesterday. We'll go on through to the 14th of February. It is an enhancement of the National Chocolate Day that was established over a decade ago. This morning, Mr. Fifi Boafo, who is head of public affairs at the Ghana Cocoa Board, is here with us to share with us some very quick notes on the National Chocolate Week celebration and what we would like the people of Ghana to know through you and to abide by. Mr. Boafo, let me invite you to the podium and please share with us the quick update on the National Chocolate Week celebration.
We are all aware that over the last 15 or 16 years, instead of what has been the Valentine's Day, we've had National Chocolate Day, a day set aside to promote the consumption of chocolates in our country. This year, the decision by government with its implementing agencies, the Ghana Cocoa Board and the Ghana Tourism Authority, is to move it from a day's activity to rather a full week activity. Cocoa remains our biggest export in terms of the revenue coming in and its impact on the Ghanaian public. And the concern all of us as Ghanaians have expressed is the fact that why do we continue exporting our raw beans instead of processing? Because when you process, you get a lot of money from it. So we have had this conversation over a period and we got into a stage where there's the need for us to put in some concrete actions that will help us achieve the set targets we've set for ourselves. But most processors or companies who are interested in processing our raw cocoa beans, the obvious question they will ask, where is the market for the produce we are asking them to come and process locally? So there's the need for us to enhance our consumption campaign such that we'll have a lot of people coming on board to do so. So this whole 1 week activity lined up. We're fortunate to have the Honorable Information Minister representing the Vice President to launch it for us last week. It started yesterday, as I've indicated already. There are a number of planned activities. I'm sure the screen over there is showing some of the videos, the National Chocolate Week videos, where we have very influential voices joining the campaign and urging everyone to consume chocolate. The president, I am told, the president's video will actually come out today. We've had that of the information minister already. The Chief Justice of the Republic, his video is already out, urging Ghanaians to consume what we produce here as chocolate. Of course, there are the leadership of Parliament. They've also added their voice to this national cause. And then you have some members of the media who have also joined the campaign. But I want to just go beyond these influential Ghanaians and get every Ghanaian participate in this very important national assignment. Because if we all join this very important national assignment, it goes a long way to help boost our revenue, which we get out of the chocolate industry. So what we want from you is to eat your chocolate, take a picture, a video, post it on social media with the hashtag GH Chocolate Reigns or National Chocolate Week. GH Chocolate Reigns or the National Chocolate Week with the hashtag. There are a number of prizes we've packaged for people who will participate in this competition. We have a number of banks who, when you visit them this week, they will give you chocolate for free as part of the National Chocolate Week. On top of that, you have some transport companies like Metro Mass. When you bought a Metro Mass bus, they give you chocolate as part of the National Chocolate Week. And a number of activations also going on. If you go to the Tetakwashe interchange right now, we had a setup called the National Chocolate City. It's not a whole town being built, but it's for you to have an idea what the value chain is like. So when you go there, you see how a cocoa farm looks like, what we call the apa, how we dry our cocoa, because our cocoa is the best, and how we treat it forms part of the reason why Ghana has the best cocoa. And of course, you have some exhibitors there where you can also get chocolate to buy. There are activations going on. You have musicians who have joined, composed very beautiful songs as part of the National Chocolate Week celebration. And we are urging all Ghanaians that if we are able to join this campaign and make sure that we promote Ghana chocolate, one, it helps with our immune system. It's an immune booster, we are told by the scientists. And it has a lot of health and nutritional benefits which we derive out of eating chocolate. And on top of that, it's also helping growing our economy, because the people who rely on chocolate are a lot. And our expectation is that as Ghanaians, our people who rely on this industry will join and make sure that the National Chocolate Week is a success and will help grow Ghana. Thank you.
Now, the old rules apply, except for the following amendments. Airlines who board passengers without PCR results, or who transport or disembark passengers with positive PCR test results into Accra, will be fined $3,500 per passenger. Ghanaian residents who depart Ghana and return within 1 week will no longer be required to present a COVID-19 result from the country of departure. They will, however, undergo mandatory COVID-19 testing upon arrival in Ghana. Passengers will be subjected to the mandatory COVID-19 test at the airport terminal at a cost to be borne by the passengers as indicated as following. Ghanaian and ECOWAS citizens now, effective, I think, 8th of February, 6 p.m. UTC, pay $50. All other passengers will continue to pay the $150, and this must be paid before embarkation. And if that doesn't take place, the airline will be sanctioned for it. Non-Ghanaian passengers may be refused entry and returned to the point of embarkation at a cost to the airline if there's no proof that they have complied with these guidance notes. Ghanaian passengers will have their passports seized, the passenger handed over to the state security agencies and taken into a 14-day mandatory quarantine at the designated location at the passenger's cost. That is for those who, for some strange reason, it is found that they have not complied. The airline will be surcharged, and the individual will also face the measures that I have just mentioned. All arriving passengers who test positive for COVID-19 will undergo mandatory isolation and treatment at a designated health facility or isolation center at a cost to the passengers, except Ghanaian citizens. I want to take that again. All arriving passengers who test positive for COVID-19 will undergo mandatory isolation and treatment at a designated health facility or isolation center at a cost to the passengers, except Ghanaian citizens. At first, the state was bearing the entire cost. This is an amendment of the guidance note, so please do take note and let the world know. Now, for passengers who are transiting and transferring through Accra, they will not be required to take the COVID-19 test in Accra. Transit passengers will be required to adhere to COVID-19 testing requirements for the destination countries. Some category of persons are exempted from this. Airline crew, as has been advertised already, are exempted from the pre-departure and arrival COVID-19 testing and should follow the airline policy for testing. There's a separate policy for them. They'll have to follow that one. Children under 5 years of age will not be required to undergo testing on arrival at the Kotoka International Airport. Passengers who arrive under emergency circumstances, such as diverted flights, will not be required to undergo testing if they do not leave the airport or remain in isolation in their hotel. Children between the ages of 5 and 12 years will be required to pay for testing at the new rates. That is the new rates that I've just outlined. And then very finally, for passengers who are departing the Ghanaian jurisdiction, passengers will be required to adhere to the COVID-19 testing requirements for their destination countries. Departing passengers will undergo temperature screening at the entrance of Terminal 3, and passengers are advised to arrive at the airport at least about 4 hours before scheduled departure time to enable all of these COVID protocols to be adhered to. So that's a quick amendment to our air travel guidance notes that I would like to share with you this morning. I want to invite Dr. Patrick Kuma Abwaje to give us a quick update on where we are on COVID, whether the situation is getting better or is getting worse, and then some of the surveys they've been conducting, and also share with us the outcome of those surveys. Doc, good morning and welcome.
Good morning. Averagely, we are reporting about 600 to 700 cases in Greater Accra, and Greater Accra still remains the one with the highest coverage. Usually about 60% of all the cases are in Accra. And they are mainly located, as always, remained the Accra metropolis and the adjoining districts. We still have an increasing number of workplace outbreaks now, because now it's moved from the family outbreaks into the workplace outbreak, and so we need to look at that. There's also recorded some decline in international travel. For example, yesterday, they tested 953 passengers with 2 positive, so that's quite an impressive reduction so far. The correct use of face masks in Greater Accra has significantly improved, but we can do more. So as of the 6th of February, we have recorded about 73,003 cases. We've conducted 814,000 plus tests, leading to about 26,114 per million tests for population, with a cumulative positivity of 9. You can see that the cumulative positivity is gone up from about 8.2 to 8.4 now to 9%. We had about 89% of this number discharged. We have recorded 424 deaths, and with active cases of about 5,515. Majority of the active cases are in Greater Accra, as I mentioned, 17% in Ashanti and Western. Currently, all 16 regions have active cases, and 243 districts, which means that we have about 17 districts that has not reported any case yet. For this current reporting period, about 8 regions did not report any case at all. We have done a lot of contact tracing. They listed about 12,000 since January, and we have followed about 11,926, and 576 of this number have tested positive, bringing the positivity among contacts to about 4.8%. As you are aware, we are talking about the new variant, and the current statistics, as based on the analysis that was done both from passengers and population, we have, I'm going to take you through what it is. The analysis, as at November, there was no new variant in Ghana, but about 90 viral sequences was done. In December, we discovered the presence of the UK variants in patients were detected. In January, when we did a mandatory quarantine at the KIA, we found about 45% of those quarantined had a UK variant. 15% had a South African variant. This is a percentage, but in actual fact, it comes about 1. In the travelers, in January 2021, the UK variant was found in patients in Greater Accra, about 88%, 90% in Takoradi, and 25% in Tamale. So far, no South African strain have been detected in the local patients in Ghana. So that is what you have shown there in the chart. If you look at the next slide, which shows at the epidemiological curve, you can see that this current wave is going up. It's remained stable up there. We are hoping that with improvement in our protocols and adherence to hand washing, social distancing, and mask wearing, and of course with the implementation of the new restrictions, we should expect that if we all follow, it should come down. And the same shows at the moving average of the cases. That is now doing about 600, has remained around 600 for a while now, the last few days. Let's hope that it stays down and starts coming down. But that will depend on what we do, and that's quite important that we do that. The next slide shows the active cases against the total number of cases ever reported. You can see that Greater Accra, Ashanti, Eastern, Central, and Western still remains the dominant area where we reported so many cases. You can look at the monthly distribution of cases. You can see that still Greater Accra accounts for a significant number of the cases at all times. And the active cases, as you can see, has reached a level that we've never reached before. We can see that it's really gone quite high. And so we need to really make sure that the numbers start coming down so that the number of active cases will also come down. Equally, the number of tests continues to rise in response to the number of positives that we are getting as we do additional contact tracing in response to the high numbers of positive cases. And we peaked almost about 4,500. We're doing about 3,750 currently a day. Now, the age distribution of the cases, these are in percentages. If you look at 0 to 5, it's about 1.3% of all the positives are, as for this year, are in the children age 0 to 11. But if you compare with incidence in 2020, you can see there's only a marginal increase. If you look at the 5 to 14, there's a slight increase in 2020, of course, looking to about 3.9% compared to 3.1%. 15 to 24, you've seen a reduction, a slight reduction from 17% in 2020 to about 13% of the proportion of those who are positive now belonging to that class. In the area of 25 to 44, which is the most active group with the number of cases, the percentage has remained the same. There's no much change. But if you go to 45 to 60, that's when you see that we have more people, aged people in 2020 who are positive, and those above 60 who are positive compared to what we had in 2020. This could also explain why we also, in addition to the new variant, we have more people falling sick because of the age changes in the number presenting. So for today, we have recorded 675 cases. Probably the first below 700 in the last almost 8 to 10 days. They came from 44 districts and 8 regions and the airport. Greater Accra recorded the highest number of 84.8% of all of them came from Accra. In 13 districts and a metro, Greater Accra recording the highest amount. Ashanti recorded 99 new cases from 9 districts, with Oforikrom recording the highest number of cases. And must say that Oforikrom and Ayawaso West, it is because of the location of the labs and the way it is reported. It doesn't mean that Ayawaso West is and Oforikrom is the dawn of COVID, but it's the reporting practice because of the labs. Eastern region had 52 cases, mainly from Upper Menyakrobo, then Chembo, Jabin, South, and Ebuakwa. Western region had 35 new cases from Takwa, Mpoho, Ahanta West, Wasa East, Jomoro, Nzema, and Wasa Amenfi. Volta region reported 50 new cases. Ho had 5, Hohoi 29, North Dai 15, Southern 1. Central region reported 10 new cases. In Upper Denchira, East and Western, 8 new cases. From Bia, 3, Bodi 1, and Sefi also, as Western of 4. In Bono, we have 13 new cases. 13 new cases in Sunyane, Doma Central, and Brekum West with 2. Doma Central had 5 cases. At the Kotoka International Airport, on the 5th and 6th, we reported 5 new cases. And as I said earlier, Bono Ahafo, Bono East, Northeast, Northern, OT, Savannah, and Upper East and Upper West did not report any case on this date. Our total number of cases on addition across the country is 267 for COVID. We have 29 of them being critical, and severe cases about 111, and the 127 of them are mild to moderate cases who are currently on admission. Let's go to the KIA Kotoka International Airport. Yeah. We have so far reported positives of about 1,158 so far, with a predominantly male 61% and 39% being female. And of course, a significant number are non-Ghanaians, 60% against 40% Ghanaians. And so far, we've tested about 157,000 cases with a cumulative positivity rate of 0.73%. So you can see that even the positivity rate is still lower than the general population in Ghana. As we said, we peaked somehow and we had a lot of large cases in December and January. But in the since February, we received some reduction as it shows on the daily positives that were recorded. And the next slide shows you that in January, we have 430 as against 46 in September when we reported. So far, at the end of the first week of February, we have recorded 27 positive cases. We are hoping that if the trend continues, we'll record much lower figure than January and December. Update from the schools. I believe that there's been a lot of talk about this. We've had upper senior secondary school outbreaks in Upper West, Western, Greater Accra, and Eastern region. 23 schools in Greater Accra have so far reported 56 cases and no fatality. And I must show that parents have duly been informed. So if I come to that, we can look at the spread of the schools that are, then we have averagely 23 cases and total recovery 0 among others. But you can see that we also have some suspected cases of about 166 that we are still following up to see. And we have some staff also affected in the schools. Central region has also reported, okay, let me talk first about the Akosombo one. As of 28th of January, a total of 500 in the Akosombo International one that has always been in the media. As at we had done a total of 553 samples have been tested, with 82 of them being positive. Students were 73 and 9 staff were positive. A total of samples have also been collected and tested with 13 confirmed positive. That's after the 31st. And so that brings the total number tested to about 600. That's almost the entire school has been tested. This was a result of a positive case at home that they decided to do a test. The Greater Accra, the national and the regional team has visited the school, done our assessment, given our recommendations on how to improve the social distancing among others protocol to cut down spread. And so all of them are well and isolated, and those who are close contacts are still being observed so that we can contain the spread. Central region and the whole region has reported 8 cases from about 7 or so schools. 2 of them have already recovered, so they have 6 active cases among the schools in Central region. So that's it for the schools. When it comes to the face mask survey, we have, I said, the adherent protocol on face masks in Greater Accra region. We have 6 target districts, which are the current hotspots. We also visited 43 communities, including lorry parks, bus stops, busy streets, street intersections, overhead, under traffic lights, crossings, markets, and commercial centers, etc. The data was collected 29 January, and then subsequent one has already been done. So, unlike the previous one where we had about 42, the number of people wearing masks appropriately has improved, moved from the 42% to 47%. Those not wearing masks at all is 29, and those not wearing correctly is 24%. So that's still quite a marginal improvement. We expect it to get a bit more. So we look at the morning and then afternoon. You can see that the morning is better. In the morning, we had about 52% wearing masks, as against 41% in the afternoon. I don't know whether it was the heat or whatever, but the number declined at that level, but the rest remains the same. So that's when you do a comparison in the morning. The next slide shows you the current trends in terms of wearing masks, that since the 7th survey, we have seen move to 42% and now to 47%. We hope that the trend will continue going up, and while those who are not wearing masks at all will also continue coming down, having dropped from 36% to 29%. Those who are wearing masks, who are not wearing masks correctly, have moved from 22 to 24%. So we are hoping that all of them will start coming down, whilst the green one starts surging. So in conclusion, the wearing of masks correctly has increased from 42 to 47. Those not wearing masks at all decreased from 26 to 29. Base mask wearing is generally better in the morning than in the afternoon. And this applies to both adults and children. 55% of children wore masks correctly in the morning, and it dropped to 29.5% during the late afternoon. 51% of adults who wore masks correctly in the morning dropped to 43% late in the afternoon. So it looks like the afternoon is something we need to really make an effort to ensure that people keep their mask on in the afternoon. And also increase generally, even the morning one. Generally, correct wearing of the mask has seen an improvement in some communities that we visited. For example, in the previous survey, University of Ghana main entrance, we had 78% of the people who observed found to be wearing their face mask correctly, compared to 84% in the latest survey. Another example is the Nima, where nearly 70% of people were not observed wearing the face mask at all. In the previous survey, declined to 67%. And so there's an appreciable increase in the adherence to the protocols. The proportion of people who are wearing masks correctly in the face mask slightly higher among adults than for the children. The proportion who are not wearing the face mask at all were also slightly higher among males than the females. And Ayawasu West District registered the highest proportion of people who were wearing the face mask correctly, 60.3%. And Ablekuma Central registered the lowest proportion not wearing masks correctly at almost 37%, 36.9%. The top 3 communities located location that had the highest proportion of people wearing the mask correctly were University of Ghana, Legon main entrance, and then the 37 military hospital bus station. The top 3 communities where they have the highest proportion of people not wearing masks are the Nima Market, Glifi Lorry Park, and Asofan Last Stop, bus stop, which is about 62% of them were not wearing masks at all. So let's take note, and I hope they also get the message. So in conclusion, compared to the last survey, the number of people wearing the face mask correctly increased from 42% to 47%. I think this is just a rehash of what we've done. We subsequently went on to do the protocol in some selected churches in Greater Accra. And these are some of the findings. The number of churches visited were about 38 in 14 districts. We also had churches, 43 of the COVID safety protocol adherents, where the denominations were charismatic, Orthodox, Pentecostal, Evangelical, Adventist, and spiritual churches. We all attended. The sizes of the churches, we have very large churches. That's those, we are classified as those very large churches with over 1,000 membership, between 500 and 999. The large, medium of 100 to 500, and the small, that is those under 100. The period of visit assessment was on Saturday and Sunday during the entire church service. The observation and count of church members of how they wore the face mask was done. And then we also look at checklists on adherence to COVID protocol was done. So what were the findings? We realized that about 90% of membership in those churches wore the mask correctly. 6% not correctly. And then about 3 or so, 4% were not wearing the mask at all in church. Comparing the proportion of whites and the general population, you can see that in the church it's 90% compared to 47% in the general population. So the churches are doing much, much, much better. We had more females that were visited. I mean, the population, about 62% were females against 38% male. So you can see that we had, for not wearing, comparative, it's about the same between male and female. So that's not wearing mask at all. It's about the same, 4.3 to 4.1% between male and female. Not wearing correctly, it's about 5.6 against 5.8. So that we didn't see significant changes between males and females, whether they wear them well or they wore at all. So if you look at the members, you can see for the church members, about 91.7% were wearing masks properly. When it came to the ushers, protocols and security, it dropped to 85.9% wearing masks. When it came to the pastors, priests, and elders, it dropped to 82% wearing masks properly. And then the choristers was the lowest, 62.6% wearing masks. If you look at also in terms of the classification of the churches, the larger churches were doing better in terms of wearing the mask. About 98.6% of the large churches wore their masks religiously. And then it drops to 73% for the small churches. So when it comes to the protocols, we looked at availability of one location at the church, that is where, when it comes to temperature screening, we had 25% having the temperature. 13 had some means of taking temperature. About 5 of them had no method of checking temperature at all. So that is in breach of the protocol that we disagree with them. Hand hygiene, we had about 7% available. Of the 43 churches we visited, 7% had none at all. They had it available. Utilization also dropped. to about 88%. So having is one, using is another. So there's a slight drop in the number of people who actually use the availability of hand hygiene protocols. Alcohol rub, only 81% had alcohol rub to spray in their hands to clean, and about 19% of these 43 churches did not have. For social distancing, we looked at adequate space arrangement of church pews and to ensure social distance in church. About 88% had. We had also church whether they maintained distance during sitting at the service. We had about 79.1%. Choristers and singers maintained social distancing. It dropped to 74.4%. Church maintained social distancing during interacting during each other during the church service. Dropped to about 41.9%, and 9.3%. As 4 churches allowed handshaking in church. When it comes to the use of the microphones, the choir members and their singers who were exchanging microphones during the singing was about 48%. They were exchanging microphones. Only 41% actually frequently sanitized the microphones that they were exchanging among themselves. So that's a major challenge that has to be addressed. Risk communication. Posters, do they have posted information about the face mask use? Yes, about 81% had the information on posters. Were they making audio announcements in the risk communication? Yes, that's also that number dropped about the use of hand hygiene and as much. The duration of church service. 47% actually went beyond the acceptable duration against 53%. So in summary, 90% of all members of the church, that's 38 churches, wore their mask correctly. 6% were not. There was no difference between the proportion of face mask wearing between males and females, and the proportion of face mask wearing was the highest among the church members compared to the ushers, as I mentioned, the protocol and security, to 80%. And pastors also, the use of masks had dropped to about 83%. Choristers and singers dropped significantly to 63%, especially when you know that during singing is when you can actually share the highest number of viruses. That is something that's worrying. Proportion of correct wearing of masks was highest in the large churches, 99%, compared to 88% among the smaller churches. We found that one church in Wejabawe had the highest proportion of members wearing the face mask correctly, 98.6%, compared to a church in Okaiki North that had 80% wearing masks only. So that's 2 churches had all members wearing masks, and we'll send them a note of appreciation. We can't mention their name here. So, some of the recommendation is that in the church, everybody must wear a mask. If you feel that you can't wear a mask during singing, they don't sing, because that's when you really shed most of this thing. All ushers, security members should wear masks at all times. So they are the ones who come in contact with nearly everybody. So that if they are not wearing masks, it creates more danger to the population, people who are protecting themselves. The no mask, no entry, and the maintenance of wearing a mask during should be enforced in all churches. We're also encouraging churches to keep record of people who attend churches, so that in the event of an outbreak, we're able to do contact tracing. We should ensure that the hand hygiene facilities are provided and utilized. Alcohol rubs should be encouraged in church. The leadership to ensure that members do not shake hands in church. Very, very important. Regular announcement of the safety protocols should be encouraged to be done more frequently, and the church should ensure that the duration of stays within the 2 hours that has been recommended as part of the restriction and the recommendations made. So in conclusion, broadly, the daily case incidence has been rising from the end of December. It has however remained high, but the number has remained stable in the last almost a week or so, and we are hoping that the number will start coming down. But of course, that depends on what we do. There's been a significant decline in the cases at Kotoka International Airport. There's been an observed improvement in the face mask use and adherence to the protocol generally. Minor sporadic cases are reported in schools in some regions, as I described earlier: Upper West, Western, Central region, and Greater Accra and Eastern region. And Valentine's Day, let's be careful. Let's wear a mask. You can take your chocolate and wear your mask back and take it. Okay, thank you very much.
But still high. It's stable, but it's still high. It's stable, but it's still high. And we need to work to bring it down. It is stable, but still high because a lot more people are responding to the calls to wear masks and adhere to the protocols. So if we think that because it's stable, we're going to go back to our old ways, then it will escalate again. Let me ask my colleagues to set up the microphone so that we can quickly take questions for the next 15 minutes. I will take 2 sets of questions in batches of 5, and then we can wrap up. As I mentioned, I know many of you want to head to the Supreme Court, so I will not take more than 2 sets of questions in batches of 5. If there are any takers. I think just about 2 weeks ago, His Excellency the President announced the tightening of some of the restrictions. And we have always maintained that all cards remain on the table, but you have to continue to monitor the data and the situation as it unfolds. Today, I think last week when we were here, the daily count was about 700. Today it's at 600 and what?
695.
695. Stable, but still high. So you are observing that data and using it as a basis to make those decisions. It's not as though there's a threshold that when you hit this number, then you're going to do X or Y. But it's the observation of the data and the introduction of the various mitigating measures that you continue to observe and take the decisions as you go along. Doc, let me let you deal with the other health questions. And
thank you. So far on, and these are, and we have a daily report from all regions. We talked about 84 so far in Eastern, 56 in Greater Accra, 8 in Central, and earlier we had reported 3 in Upper West and 1 case in Western region. And as and when the number comes up, we will update it. But this is looking at the number of children we are dealing with. This is probably tells you that the surveillance system is there to identify them, and that the number is not, 1 is high, but it's comparatively, I wouldn't say it's an alarming number. That is because this was expected. It was expected in the first 3 to 4 weeks, because people are going to move from home to school. You're going to have some cases, as happened in the previous exercises. But over time, we are hoping that with the tightening of restrictions, adherence to protocols, we will actually get it better. The total number of deaths, as was mentioned, you see, you are looking at the whole of the year, when we started from the 12th of March with 2 cases. But if you look at the June, July, August, when we had the high increase, of course, the total number of deaths gone up. We started the year with an increasing number of cases. And so we will need to compare it appropriately within the various spikes to see what is happening. It is hoped that as the numbers come down, the number who are ill will come down, and the number will come. Maybe I also mentioned that, look, people should apply the most appropriate health-seeking behavior. People are staying home, trying all kinds of remedies, and not reporting early. And that is causing, that's something that we hope that the media will also help us carry out, that please seek care early. Don't go online, don't go and read social media and do all manner of things. Because in COVID, your situation can be stable, you can change in the next 1 hour. And so observation extremely important that you seek early. The total number of cases, active cases, about 6,938 now, under the most current figure was just published just when we were coming here, and the death has increased to about 482 so far, 82. We continue doing monitoring, doing the sequencing all the time. And like I said, at the KIA, we found the variant, the two variants, and those who were quarantined, the foreigners who were coming in. As far as the patients are concerned, we found the UK variant, and it seemed to be the dominant variant now. Whereas among the Ghanaian community so far, we've not found the South African variant. But like what you said, the information we have is that South Africa is reporting that it doesn't do well, the AstraZeneca doesn't do very well with the South African strain. That's why South Africa has suspended to observe and continue more assessment for 2 weeks before they decide whether they will go ahead and use it or not. And I think Ghana continues to do our sequencing and monitor to see how we will take this forward.
Yeah, I think you've covered it. We'll take a final batch.
Costs of chocolate being expensive. Well, we are talking about made in Ghana chocolate. If you compare made in Ghana chocolate and chocolate from elsewhere, I do not think that made in Ghana chocolate is expensive. But what I say is that, for example, if we increase consumption, our companies will be able to process more. When they process more, cost of manufacturing or cost of processing will come down. That will force price down. So this is part of the process where we'll be able to bring the price down and we all can consume chocolate. But for example, if you look at a bottle of a cocoa powder compared to other products, I do not think that the price is that high. But of course, when we are able to increase consumption and the companies are able to process more, definitely will have an effect on the price. On the issue about delaying payment to license buying companies, we've answered this question and we're not expecting to have this conversation take precedence over the national activity, that's the National Chocolate Day. But I would like to state that if anyone tells you that we've not paid farmers or license buying companies since November, that is untrue. That is not the case because Cocoa Board has already drawn down about 1.1 billion, which about 92% of it, plus money sourced from Bank of Ghana, have been used to pay license buying companies. We admit there's been some delay, and the expectation is that this very week we'll draw now the remaining $190 million, which we'll use to service the remaining amount of money we are supposed to pay to license buying companies. But that does not mean that because there's a delay, we cannot continue to promote the consumption of chocolates locally and also boost our economy. Thank you.
It's not under the management of the government of Ghana. You recall an independent board was put in place. The fund was set up pursuant to a law passed in Parliament. The Sophia Kufu board was put in place. They are the ones responsible for it, and they can answer questions associated with that fund. I think quite recently they provided some updates on it, but your questions will be best directed to them. Doc, let me box these questions together. Do you plan on doing surveys that go beyond the ones that you do to deal with, let's say, mosques and then post-COVID recovery residual issues, for example?
Yeah, thank you very much for the questions. Yes, we have plans to visit other sites. We move from the streets to churches. We'll go to other places. We'll do other workplaces, etc. We'll continue doing the monitoring in those areas. And as and when it's done, it will be shared. So this is at the beginning of where we are going to actually go into the schools again, schools to really observe protocol. So all that will be shared with you. Now, talking about the schools, so far we've not had any COVID-related death, not even in the previous openings. There were some reports of that, but none of them was actually COVID-related. So far we've not had any death. In fact, those who are tested positive. In Greater Accra, it's only one that was managed in the hospital. The rest are asymptomatic and up and about with the work, and they are currently in isolation. We have a post-COVID clinic. I'm sure some of you have heard Dr. Comey talk about that. We know that COVID affects almost every organ in the body. And so when you recover, it's a new disease that will continue to follow. So they are followed up. And they follow up on their health of state, their lungs, including their erectile dysfunction, if someone comes to report on that. And so that follow-up is going down. I think over the period, we're going to learn a lot more about the consequences or the sequelae that it leads to. Our duty is to do risk communication and encourage people to abide by this. I'm sure if you are not wearing masks in a public place, the laws are there. And I think it should apply. I'm sure the honorable.
Yeah, and I think if you followed the president's admonition, and that's what I'll be ending on, the police have been asked to step up enforcement. That includes closure and ensuring that the various persons who breach these restrictions are subjected to the force of law. So it's the same rule that will apply.